no matter how prepared you are, it's a difficult journey to take. For most people, it's something that they've never done before. The rug of control is pulled out from underneath them, something that we all work so hard to maintain in life. And to be robbed of that really does usually result in some significant distress, either emotionally and physically. So to be able to help somebody be equipped with a toolbox, so to speak, to maneuver through the cancer experience really does make a significant difference. What we try and do, and this is drawing from a more general literature on, and intervention on psychology, is help people think accurately about their situation. I actually don't like the term positive thinking, which may sound strange for a psychologist not to like positive thinking, but I don't expect any of my patients to put on rose-colored glasses and say everything is perfect, everything is going to be just fine. But what I do expect them to do is to learn to think accurately about their situation. If they're having an emotional reaction to their experience, I want it to at least be based on a thought that's factual and present-focused and accurate. And that's something that you can learn, and that's something that you can teach somebody to do. You can be more scientific with your thinking and be able to step back and say, if I'm having fear, if I'm having anxiety, if I'm having uncertainty, what's the thought that's driving that? And is it an accurate thought? Or is it distorted in some way? And if it is, there's wiggle room to replace it with something that's more accurate. And typically when we're thinking accurately about a situation, our emotions are more manageable. Attention to how you're doing emotionally, how you're doing spiritually, how you're doing socially, is critical off the bat, because it's an assessment. The same way that there's a focus on having a plan for the medical piece of it, you can have a plan for the psychosocial piece of it. And for many patients, they're doing things really well already, and drawing from that is important, but also addressing where are the gaps, and what aspects of this new venture are not going to be able to be addressed with what I now know. I have to learn new things. I have to cope in different ways, and asking that right off the bat is important. I see women and men alike and patients step up to the plate every day and do an amazing, amazing job with coping with their cancer experience. Most people don't really need me, but just a reminder of what they're doing and how positive they're dealing with the situation.